Thank you very much, Mr. Speaker. I rise in support of the budget bill before us, and I do want to talk about some numbers. I've heard a lot of numbers today, and a lot of them are in relation to Medicaid and the welfare budget. We've already heard from the gentleman from Bucks County that nearly 80% of our entire state budget is either education, a combination of education and health and human services through the Department of Public Welfare. Under the governor's proposed budget, and again, this is the starting point, we're going to get a different budget for final approval. The governor provides more money. He increases state funding to DPW by over $315 million, or 3%. And let's stick to the numbers. This accounts for nearly $11 billion in state funding and $28.4 billion in total spending in the Department of Public Welfare. That's a combination of state, federal, and other sources. It's an amazing number. It exceeds nearly our entire budget. The budget prioritizes funding to address the needs of Pennsylvanians with intellectual and physical disabilities. It increases funding for senior citizens, children, and low-income families. Again, let's look at the numbers. We're expanding services for individuals with intellectual disabilities, expanding services for older Pennsylvanians or senior citizens. We're expanding services for individuals with physical disabilities. We're expanding services under the Child Care Assistance Program. We're extending services to improve the quality of child care programs. We're improving services to help at-risk children. We're improving services to specialized hospital services, to fund critical supplemental payments to hospitals, including neonatal facilities, burn centers, trauma centers, and critical access facilities. Again, let's look at the numbers. In Pennsylvania's Medicaid program, we're already experiencing crowd out in other areas, such as transportation, education, and other public services. The fact is, approximately $22 billion in total funds spent annually on Medicaid currently, without expansion. Currently, we're spending welfare dollars for 1 in 6 people in Pennsylvania, $8 billion in state funds, nearly $12 billion in federal funds, $2 billion in other funds. Total Medicaid spending accounts for 73% of the entire department's budget and nearly 30% of the entire general fund budget. That's just Medicaid. The cost program is over 30% for the entire Pennsylvania general fund budget and continues to grow. The Department of Public Welfare projects growth by nearly $600 million in new state dollars alone in the next fiscal year. Again, let's stick to the fact. We currently spend more as a portion of our general fund on Medicaid than every other state in the nation, except for Missouri. Our average cost per enrollee is around $7,400, while most states spend between $4,000 and $5,000 per enrollee. Fact, 2.2 million people are already enrolled in medical assistance. We've seen an 8% increase in medical assistance enrollment in the last 3 years alone. Our program features statewide managed care for physical and behavioral health services with over 68,000 medical assistance providers, and it processes more than 17.4 million claims a year. Pennsylvania's Medicaid program has already expanded over time to include populations and services that most other states do not afford their citizens. Mr. Speaker, let's pass House Bill 1437. It's balanced, it's on time, has no new taxes. Let's get her done.